Hello my dears, today I will tell you about 10 causes and risk factors for gallstones. I will name all the most common causes of gallstones, including those that you can directly influence. What's more, you will find out which country has the lowest prevalence of gallstones, so watch the video to the end. Cholelithiasis or gallstones is one of the most common and costly of all the gastrointestinal diseases. Gallstones are hardened deposits of digestive fluid that can form in your gallbladder, a small organ located just beneath the liver. The gallbladder's primary function is to store bile, a substance produced by the liver to help digest fats. Gallstones can vary in size and are classified mainly in two types: cholesterol stones, which are the most common and are primarily made of hardened cholesterol, and pigment stones, which are smaller and darker and made up of bilirubin. Pigmented stones are roughly divided into brown and black stones. Brown pigment stones are soft and fatty, consisting of bilirubinate and fatty acids, calcium palmitate or calcium stearate. Black pigment stones are small, hard biliary concretions that are composed of calcium bilirubinate and inorganic calcium salts, for example, calcium carbonate and calcium phosphate. There are also mixed stones. However, the vast majority of gallstones are cholesterol stones. More specifically, in Western populations in Europe, cholesterol gallstones account for 90–95% of all gallstones. In the United States, more than 80% of gallstones contain cholesterol as their major component. Let's move on to the causes and risk factors for gallstones. The formation of gallstones is a complex process influenced by multiple factors. First, one primary cause is the supersaturation of cholesterol in bile, which can lead to the precipitation of cholesterol crystals, eventually forming stones. This condition can be exacerbated by the gallbladder not emptying completely or frequently enough, allowing bile to become concentrated and more likely to form stones. The combination of changes in the composition of bile and the presence of its stagnation in the gallbladder leads to biliary sludge, that is, the appearance of a thick sediment in the gallbladder. Second, diet plays a significant role in the development of gallstones, especially a high-calorie and high-fat trans fat diet that can increase cholesterol levels in bile. A diet low in fiber can also contribute to gallstone formation. Thus, the likelihood of gallstone disease is increased by consumption of typical Western hypercaloric diets, including high meat intake. So, when I take on dissolving stones in my patients, the first step is to normalize their nutrition. Third, obesity is another significant risk factor closely linked to increased cholesterol in bile, which makes gallstone formation more likely. In obesity and metabolic syndrome, not only is cholesterol secretion into the bile increased, but the body's sensitivity to cholecystokinin is also decreased. Cholecystokinin is a neuropeptide hormone that is produced in the intestine and improves the flow of bile. Fourth, rapid weight loss and fasting can decrease gallbladder movement, leading to bile stasis and consequently gallstones. That's why my patients lose weight gradually, no more than 5 kilos per month, slowly but surely, without increasing the risk of gallstones and other complications, without stress and setbacks. Fifth, certain medical conditions such as diabetes can also increase the risk due to the higher levels of triglycerides, which may enhance gallstone formation. Moreover, specific medications like cholesterol-lowering drugs and hormone replacement therapy can alter the composition of bile or its flow, further contributing to the risk. Cholesterol can be lowered by other, more gentle cholistic methods. Statins to lower cholesterol, in my opinion, are more of a desperation therapy that is filled with risks and side effects. Sixth, genetics also play a role. Individuals with a family history of gallstones are at a high risk. Genetic causes of gallstones are due to mutation and polymorphism of some genes, genetically determined decrease in enzyme activity, peculiarities of mitochondrial DNA, etc. However, there is a very important point to which I draw your close attention. The contribution of genetic factors to the development of cholelithiasis in twins can be estimated at 25%. The remaining 75% depends on environmental conditions, 13%, and individual lifestyle characteristics, 62%. In other words, even if you have a gene mutation, your risk of gallstones is 75% dependent on your lifestyle, and that's great. Seventh, age and gender are additional factors, with women, especially those over 40, being more susceptible, partly due to the effects of estrogen on bile composition. Furthermore, pregnancy can increase the risk because of hormonal changes that may increase cholesterol in bile. I would also like to add such a non-obvious condition for many people with gallbladder and liver problems as a psycho-emotional state, in particular negative, critical thinking, suppressed anger in combination with other listed reasons can accelerate the formation of gallstones. Eighth, ethnicity influences gallstone prevalence, with Native Americans and Mexican Americans showing higher rates, possibly due to genetic predispositions and eating behaviors. The lowest prevalence of gallstones is found in Japan. Ninth, certain gastrointestinal diseases and surgeries such as Crohn's disease or ileal resection can affect bile salt absorption and thus gallstone formation. Long-term fasting patients, especially those on total parenteral nutrition, also have an increased risk of gallstones. 10. Lastly, a sedentary lifestyle can contribute to obesity, again linking back to gallstone risk. So get up and start to work out. In the next video, we will discuss symptoms of gallstones, methods of diagnostics and treatment methods. Hugs everybody, your Dr. Zarifa Romanova.